Hi guys, I hope everyone is ready for today's quiz. I hope you're excited as well. We're going to start the quiz at 10:10 p.m. All of the links are sent through the Telegram channel. And to join the quiz, you can scan the QR code along with, just go to our slide and put the code. The code is 91SB8.
Yes, today we have 20 questions. So from tomorrow, we'll start with pharmacology and we'll send you the timetable soon after the quiz ends.
Right. What do you think, Dr. Manoj, is the math scoring subject?
Yeah, I think it's not too easy also. It requires some effort
It
to remember
requires.
things and get.
Well, nothing came in so handy when we talk
Mhm.
about, studies.
Yeah,
I think having a gist of, few of the disease, having to know what does a few of the terminology means, I think they do benefit a lot if you know them well.
yeah, right.
So guys, today is Dermat. It's a it's it's what we call a short subject, and I hope everyone is prepared. 3 minutes to go, guys. As you know, guys, that there are no negative marking, and I hope everyone is knowing that you can answer. It's a free quiz. The faster you answer a question, the more points you get, and every question counts. The like, just remember, every question counts, and you should know the answers. Even if you can rule out other three, that is also a plus point. So you can take whichever route suits you, and it would be great. I see we have like the consistent players.
Hmm. Yeah, we have got one of our old player also here
Oh,
from the very first quiz.
excuse me. Yeah, Mr. Heyman, Dr. Heyman. Hmm.
Yes.
Even Vishwapriya has been regular. Good
Hmm.
guys have been all like nice and consistent peeps. Let's go, guys. Last 1 minute remaining. Manoj, what comes to your mind when I say pupil?
What? Pupil.
Yeah.
Pupil, I think more of related to ophthalm only. The first thing comes to my mind now.
Yeah. Uh, in other terms, in a layman's language, a pupil can
Hmm.
also be, that a child, uh, the
Hmm.
son of son or something. So there was this
Hmm.
one case that came to the OPD today, and he was addressing his child as pupil. And I'm like, does
Hmm.
he have some ophthalmic crisis or something? But then it
Hmm.
was this way that he addressed the son. So, there are so many factors that you should know. Sometimes you can just get confused, like in an exam as well. These are like common factors, but you may get
Hmm.
confused.
Yeah. So I guess it's time. Shall we start?
Yeah, let's go.
Yeah.
All right, guys. I hope you guys are all ready. So, welcome everyone to today's quiz session. We have some interesting domat questions coming in your way. So, let's dive straight in. Your first question in front of your screen coming up. A patient presents with hyperpigmented aesthetic patches on his forearm with loss of sweating. A slit skin smear from the lesion shows acid fast bacilli. What is the most likely diagnosis?
So think about a disease associated with nerve involvement here.
Mm-hmm.
So this is the easy one to start with.
And you say, agreed. Nice. Very
Okay,
nice.
let's. Okay, we have Mohan. Mohan in the first place, and we also have A, who is at the same points,
Right.
and followed by Vishnupriya, Hemant, Faizi, Soumya Shri, Kapita. Okay, guys, let's move on to the second question.
Goodness.
40-year-old male presents with multiple painful flaccid blisters on the trunk. Nikolsky skin is positive. Direct immunofluorescence of perilesional skin shows intercellular IgG deposition. Okay, what is the target antigen in this condition?
This is also a baby question.
Hmm.
Guys, remember, all right, in case you're looking for a hint, here you go. Look for a condition associated with acantholysis and autoimmune destruction of cell adhesion molecules. Nice. Good. And let me add a fun fact over here. So desmosome
Hmm.
1 and 3 together are called hemidesmosomes. And this was a question that was asked in just a recent NEET PG. So they asked us the same question, but instead of DS uh,
Hmm.
DS1 and DS3, they wrote hemidesmosome. So imagine the wording of the question.
Hmm. Yeah, right.
All right, guys, moving on. The competition is tough. We get it. It's a cutthroat one. Keep it up. Third question. A male patient presents with recurrent blisters and erosion in the axilla and groin, which worsens in summer. The condition was not present at birth but developed in adulthood. Biopsy showed suprabasal acantholysis with a brick wall appearance. What is the most likely diagnosis?
So, guys, think of a disease with chronic relapsing course, okay? And there is a summer exacerbation.
Right?
The histopath is distinctive here.
It's a brick wall. It gives a big, easy peasy.
Yes,
All right,
it's Haley
guys.
Haley disease.
When we talk about pemphigus, guys, it's more like towards a bullous, and it is not a bullous bulla, if you can see.
Okay. We have Faizi now, who is leading the quiz, and we have Rakshaya Vasudevan in the second place, followed by Myra, Sundar, and Vishnupriya.
All right, guys, going great. Let's move on.
Okay, a 30-year-old woman presents with well-defined depigmented patch over her forehead, exactly where she applies a bindi. She denies any other skin complaints or systemic illness. What is the most likely cause for her condition?
All right. So, guys, giving you a hint, this is a contact induced and localized to areas of direct exposure. This is baby. This is the baby. If you see the picture, and you should know the answer. Let's see how many got it. Nice.
Yeah, it's contact leukoderma.
Hmm. So now we are coming
Not much
up.
changes.
Yeah,
Yeah.
coming up. Great. Let's move on to your next question. A 35-year-old female presents with hyperpigmented thickened cell in the axilla, neck, and groin. He is She is also noted to be obese. Biopsy the skin reveals hyperkeratosis and epidermal pallidoluysitis. Which of the following underlying condition is most likely associated with her presentation? It can be anyone, guys. It's gonna be the disease that is having it. So he or she maybe. What do you think is the reason?
Yeah, this is the one image you should never forget.
Right, right.
Yeah.
PCOD not doesn't relate to the facts, guys. Doesn't relate to the fact.
Yeah, not much changes here in the leaderboard. Let's move on. 28-year-old female presents with butterfly-shaped rash over her cheeks and nose, which worsens after sun exposure. She also complains of joint pain and fatigue. What is the most likely diagnosis?
You know why
I
I
think
like
I have missed one option.
it's okay.
Okay, guys.
Either with PB one. And I would say you know why I like Dermat? Because most of the time if you see the image, you know what it is.
Yeah,
If you have read it.
more
If
of
you have read
a
it.
okay, no points. There was an error, guys. So
Oh, alright. 20. Moving on. A 19-year-old female presents with localized hair loss over the scalp, along with signs of recurrent pulling of hair during periods of stress and anxiety. There are no scars or inflammation noted in the affected areas. What is the most likely diagnosis?
So here, look for a condition that involves self-induced hair loss, okay, related to any behavioral pattern.
Right. I would help you to rule out alopecia areata because it's not.
Hmm. Yeah.
Hi, good. All right, guys, so you're doing great. We had Fezzi with still leading the board.
Okay, 24-year-old female presents with painful erythematous nodules on her shin. She reports a recent history of upper respiratory tract infection. On examination, lesions are tender, well-defined, and present over extensor surface of her lower legs. Chest X-ray shows bilateral hilar lymphadenopathy. What is the diagnosis?
And in case you're looking for a hint, here we go. I would say think about a condition often triggered by infection and associated with granulomatous inflammation. What do you think? Perfect.
Yeah. Yeah. So the diagnosis was sarcoidosis here, in which we
Hmm.
can see erythema nodosum. Okay.
All right.
Here we have Faizi, followed by Rakshaya, Myra, Sundar, Ben Stokes, Reddy, Hemant. Vishnupriya, Shanmugapriyan, Karthi. Okay, guys, moving on.
You guys are doing great. Let's keep up the pace. A 40-year-old male is diagnosed with leprosy and is started on multi-drug therapy. Which of the following drugs includes in the MDT therapy? Sorry, MDT regimen. It's a baby. It's like the second year
Yeah,
में ही हमें बता दिया था याद कर लो.
it's neonatal. Neonate question.
Actually,
No, but
no.
we might get confused if we don't revise it.
Revise. Yeah, that's right. I think two options. Oh no, most of you have got this right. The two people who got the one, I get it. It's Tapson. Hmm.
Okay, again, not much changes. They're holding their place.
Good going, great going. Let's go to the next question. We are half of the quiz, guys.
40-year-old male presents with hypopigmented macules on his face 2 years after being treated for fever and spleen enlargement. So, skin biopsy shows granulomatous inflammation with intracellular organism. What is the likely diagnosis?
Well, I would say it is. This condition is associated with chronic systemic infections that involves the skin on the later part.
Hmm. It actually mimics one condition.
It does, and it's there in the option as well.
Yeah,
Aha,
it's
nice. All right, guys.
okay. We
Okay.
have Myra now, who is leading.
Aha, nice. So see, guys, each question gives you good points. So remember that, and it can help you to lead up the leaderboard. Moving on to your next question. A 32-year-old male with onset arthritis involving multiple joints, especially the distal interphalangeal joints. He also has nail pitting and oncholysis. What is the most likely diagnosis?
I think the question only has the
Its
clues
own
here. There is
answer.
arthritis,
Yeah.
then there's nail pitting, then
Mm.
there's onycholysis, and the image is given.
It's easy peasy. Is it for them? Let's know. Nice.
Yeah.
All right, guys. So I see most of you have come prepared, which is a good thing. Moving on to your next question.
28-year-old male presents with painful, boggy, inflamed mass on his scalp associated with purulent discharge. The lesion has hair loss at the site, and he has a history of ringworm in the past. Okay. What is the likely diagnosis?
Hmm. What can it be? What can it be? Ha. All right, guys. So giving you an option. Uh, I mean, indirectly, I would say. Think about a fungal infection that can or does cause scalp abscess.
Yeah,
Bravo.
right. Let's carry on. Can you
Dina
guys tell
capitis.
what is the
Yeah.
yeah,
Okay. So Dina capitis, guys, it's like a black dots on your scalp. So that's a no. That is, and if you read it properly, it's fluoride in discharge doesn't come from the Dina capitis. All right. You were saying, Dr. Manoj?
yeah, I was asking them, can you tell me what is the treatment for tinea capitis?
Can they? All right, guys, if you know the answer, shoot it up. Let's see who gets it.
Okay, we have Myra, Sundar, Faizi, Raksha, Reddy, Vishnupriya, Karthi, Suren, Ben Stokes, and Shanmugapriyan.
All right, guys, you're doing great. Let's keep up the pace. A 8-year-old child presents with multiple painless papules with a central umbilication on the face and trunk. The child has no significant past history. What is the most likely diagnosis and a positive organism?
So this is a common condition in children, okay, with viral origin, and this is a painless condition.
Okay, okay. Have you got it?
Yeah, most of them have got it.
Chicken pox, spicy chicken pox. How?
Okay,
All
again,
right,
not much changes.
guys. Great going. People are keeping up the streak. It's great.
28-year-old woman presents with severe pruritus on her finger, wrist, and web spaces for 2 weeks. Examinations show a linear burrow and vesicles. So the patient's two children have similar complaints. What is the most likely diagnosis and the main method of diagnosis here?
I would say, why does it sound, like a parasitic, infection? Does it sound like that to you?
Yeah, seeing the linear burrow and vesicles, I guess we can guess
Yes,
it.
that's true. Wonderful. Very nice, guys. All right. The competition is up. So is there space? Let's go. Last 5 questions. A 40-year-old male with chronic diarrhea presents with itchy grouped vesicles on his elbow and knees. Skin biopsy shows granular IgA deposit at the dermoepidermal junction. What is the most likely diagnosis?
So consider a condition that links to dermatitis with diarrhea and autoimmune features. So
Hmm.
there is IgA deposits here, granular IgA deposits. That will be a very important clue. Yeah.
For bullous pemphigoid, guys, it is IgG, not IgA. All right. 1200 points, Myra. Let's go.
Okay, a 30-year-old male presents with scaly annular lesion with raised border on his trunk. So KOH examination reveals hyphae. What is the most likely diagnosis? Again, a easy question.
That's true. That's why I'm saying, Domat is a little easy peasy.
Hmm.
But it's
Yeah.
not soaring. It's kind of soaring to the eyes, I would say. But
But
it's
if you
cute.
don't revise, everything looks the same.
Same, yeah, yeah. Just like Patho.
Yeah.
Our histo slides.
Yeah, it's tinea
Right.
corporis.
All right, guys. Doing great. Hmm. So we have
Okay,
Myra
let's.
leading the leaderboard, followed by Sundar. So, all right, guys, you're doing great. Let's go. A 22-year-old female with a history of severe acne vulgaris develops spitting scars, hypertrophic scars, and inflammatory nodules on her face and upper back despite being on topical treatment. What is the most appropriate next step in management? Guys, it's like these people, they love asking this next step of management, and especially when it comes to acne. So I would say read more about it because they've asked continuously in previous 3 to 4 years paper. And nice.
Okay, again, not much changes. I think Myra will be a dermatologist.
Dome.
Myra, Sundar, Faizi, all of them.
Wonderful. All right, guys. Next question.
So, a 30-year-old male presents with lesions as shown in the image, okay, on his extremities after a HSV infection. So, there is mild mucosal involvement. What is the most likely diagnosis and hypersensitivity type?
Mm-hmm. I would say, it involves something
Hmm.
related to a delayed type of hypersensitivity response following
You
HSBC.
told the answer actually.
Oh shoot, did they?
Okay, yeah. It's type 4.
All right, guys.
Finally, we have Sundar now who's leading, followed by Myra, Faizi, Vishnupriya, Reddy, Rakshaya, Shanmugapriyan, Karthi, Suren, Hemant. Okay, guys. Okay.
All right, guys. You're doing perfectly great. Hemant, you can pick up. Don't worry. I think you should know what it is called, a direct immunofluorescence test. So, reading out the question for you, a middle aged patient with flaccid blisters on his skin and oral mucosa undergoes skin biopsy. This is the image shown. What is your likely diagnosis?
Yeah, look for a condition involving the autoimmune blistering with Nikolsky's sign.
Mm-hmm.
Right. It's pemphigus vulgaris.
Bravo, bravo. All
Okay,
right,
moving on to
guys.
the last question.
Yep.
25-year-old female presents with hypopigmented patches on her face. On examination under a wood lamp, the patches appear bright blue whitish color. What is the most likely diagnosis?
What is your likely diagnosis? All right, guys, I would
Yeah.
say the last thing, the clue, where there is a loss of pigmentation, which leads to bright fluorescence under UV light. Let's see if you get it. Hmm. All right, a
Okay, I
mixed,
think. Next one.
yeah, a mixed reaction. Okay, it's a minute difference between both. I do agree. And we have
Oh,
Myra.
okay. Finally, Myra got back to the worst place. So,
All right.
congratulations, Myra. Then,
Congratulations, Myra.
yeah, we also have Sundar in the second place, Faizi in the third place, and
Mhm.
Rakshaya, Shanmuga Priyan, Vishnu Priya, Hemant, Reddy, Karthi, Urvashi. So, congratulations, guys.
It was a very great going. You guys have done great.
Yeah,
All right, guys. So that's all for today's quiz. Great job, everyone. It was lovely seeing you all being consistent. And thanks for everyone. Thanks everyone for participating as well. We hope you have found these questions useful for your preparations because we look for that as well. So stay consistent and stay tuned for more challenging quizzes every day at 10 p.m.
yeah. See you all in the next quiz, guys. Good night.